Welcome back to the Paul White Show. We're visiting with Dr. Collins, that's affiliated with KU Med. We've been talking about a study that's going on locally here called PAD. I can't do the scientific doctor terminology, so I'll leave that to her. But my little deal is PAD. I can handle that.
There you go. That's perfect.
I can handle that. Okay, what are some of the symptoms of PAD? I know previously we talked about the screening and how you can tell if they qualify for, to participate in the in the survey. What are some of the symptoms that maybe an individual could recognize themselves without even?
Right. So we have categories, or we label someone as being asymptomatic without symptoms, which may be that they're actually not recognizing the symptoms versus not really having symptoms at all. Okay. And they may be self-selecting to be less active because they get discomfort in their legs and think that it's a natural part of aging. Right. So there's that group. And then there's the group with the classic symptoms that we think about, which are cramping in the back of the legs or in the thighs with walking. So it can be in the calves, the thighs, the buttocks. It's not joint pain. It really is the muscle pain. Okay. And it comes about with walking. And it could be perceived as a heaviness, a cramping, an ache. We each have different ways of describing discomfort. But if you find that there is this discomfort in your leg muscles with walking, you definitely should be screened for the PAD.
Okay. And normally, well, a lot of older people, though, are getting into the habit of walking because there's a lot of senior recreational facilities available in the neighborhoods where they can do a little exercise or play games or whatever and all these kind of things at the neighborhood senior center. But they can still have some of these symptoms even though they don't do a whole lot of walking or exercises.
Right.
But they just have to be mindful and be noticeable. But like you said, some of them are probably not noticeable.
Right.
And they don't associate it with PAD.
Right.
Because like you said, they think it's a part of getting old. So they don't, they're just, I'm getting old. So.
Right. But one thing about this study, yes, we want to get this study done to figure out in the future how best should physicians, other clinicians motivate patients to walk if they have PAD, particularly if they're African American, given that this study is focused on that group.
Right.
But at the very least, it'd be good for you to know if you have PAD so you can be appropriately treated, your risk factors managed. So getting screened is a good idea.
And I mentioned walking on your own. Do you give them, like, you need to walk a quarter of a mile a day or you need to walk whatever?
We
2
do
blocks
give them
a day, 3 blocks a day.
We do give them guidance on how, and we do it in minutes.
Right. Okay.
So we want them to walk at least 3 days a week, if not 5, for either 30 to 50 minutes each time. But they may have to build up to that.
Right.
So hitting someone with that up front, they're like, well, I don't know if I can do that. But we allow for them to build up to that walking level.
Right.
Yeah.
Do you furnish someone got these little walking meters?
We do provide little
kind of
pedometers to keep track of their steps.
Yeah, okay.
We also actually, people may be worried about their time, the cost, gas.
Right.
We do provide some gift cards to help offset the time commitment.
That they committed to do the study.
And we do that at various stages. And then once they're in the study, we actually provide for the length of time they're in the study and following through with protocols. We provide vouchers for that, commitment.
Okay.
Yeah.
Okay. Yeah, most studies will kind of compensate you. Plus, sometimes they furnish, if it's a medical, the medicine and all that stuff, you get along all that goes with the study, in other words.
The thing we do is we steer clear of medicine because we're just trying to change behavior, which I'm excited about because then, it's a lower risk type of study.
Right. Absolutely.
Yeah, but it's a good point.
Physically do it besides medically do it.
Right.
With medications and stuff. Okay, so the study is in recap, the study is a whole year. They need to call to get screened.
Yes.
To see if they qualify.
Right.
And then you said about 6 months, if they pass all of that, they're on their own. The first 6 months of the study, and they only get so many phone calls to follow up.
Right. Twice a month for 3 months and then once a month.
Okay.
For that first 6 months. And the last 6 months, we have minimal interaction with them except to say happy birthday and to check on them. And
right.
Yeah, so we're going to be enrolling for another, 2 years just about.
Okay.
But when you enroll, you're only involved in the study for a year.
Right. Okay.
Yeah.
Okay. So to complete that. And the number again is 293-3567, and the area code is 316. Now, you will take anybody in the Wichita and the surrounding area, so you don't have to be right in the metro.
No.
Okay.
If you're willing to commit and be involved, we'd love to have you.
Okay. And African Americans, and the age is...
We don't have a cutoff for age, but typically the people who have this disease are at least 50 years of age or older. But we do find those who are in their 30s who they either have diabetes or smoking. So, yep.
Or some other ailment that encourages PAD.
Exactly.
Okay. All right. Well, thanks for being here today, Dr. Collins. I hope that shed some light, and I hope some people give you some call and participate in this study. I'm kind of interested. I'm kind of in that bracket, what's going on with the study. Now, after 5 years, I'm sure it'd be a publication out of what was found. And
my goal is to have not only the publications that go into the journals, but to actually, what I did with a prior trial was to hold what we call a reunion and get people to come back, and we give the results, and they can sit and visit and meet other participants who they may not have met before. So.
Right. Oh, okay.
Yeah.
All right. All right. Well, once again, thanks for being here.
Thank you.
Thank you.